eggs.
That's-
And when there's an
I know we
official
talked
recall
about
from
the,
FDA, you get a lot number.
our ability to negotiate on our behalf, bill, and that type of thing.
That's the only way you can
That's
do it.
all national, so I don't know
But anyway, here's one of our other labels.
the other deal. But I'm gonna find out today.
This is just one that we normally get, so this top part would go on, say, said bag without a lot number, just that information. But on this work label, that's where we put a lot. That's where we put that.
Try to call you.
I know where I was.
Hospital invested the
I was in a
time and energy.
man sales
or appearance of conflict and refrain from any participation in a particular matter. Here and now we proceed. Mr. Campbell, will you start off the meeting, please?
There are two meetings for which we have minutes, Mr. President, the September meeting and then the board member retreat minutes. Both have been provided to you, so you can take them together or separately, as is your pleasure.
All right, let's try to take them together. Do I have a motion to accept the minutes for the September meeting and the board retreat minutes? Second? All in favor?
Aye.
Motion carries. Mr. Campbell?
Before we get into the substantive, just to let the board members know in the audience, we do have a short agenda today, and that's largely because we've been about meeting to death over the past month and a half. So there was one quasi-disciplinary hearing that was on the agenda that came off, so we will be out of here in short order today. But we do have some things to discuss, and certainly the time is available for as much discussion as you want to have. And along those lines, we do have a continuing matter from the September meeting, and that is the rules, proposed amendments and repeals of rules governing the practice of compounding under North Carolina law. I provided each of you after the September meeting with a memorandum that summarizes the public commentary we received. Just in very brief, to recap that, virtually all of the commentary, substantive commentary, was focused on paragraph I of proposed amended rule 2801 concerning lot number labeling. I've summarized my understanding of what the primary commentary was, and that was that the commenters felt that paragraph I created a labeling requirement that USP 797 does not require. Each of the commenters agreed that healthcare facilities and all pharmacies do need to comply with USP chapter standards, but question the need and value of a supra 797 lot number labeling requirement. Staff commentary, and I'm admittedly not an expert, I'm only summarizing what he said. One way to deal with this could be to eliminate paragraph I from the proposed rule and adopt it without paragraph I. Mr. Pinion and I have consulted. We do not believe that if we eliminate that paragraph, we would have to republish the rule, because elimination of that paragraph removes an obligation under the rule. It does not add one that could not have been reasonably foreseen by those, et cetera. So we don't think it would require republication. You certainly could republish it if it was your desire to do so, but you would not be obligated to do it. There does seem, and I imagine this is going to be a theme that we're always going to have to deal with, there may be some disagreement about whether USP 797 chapter requirements require the same type of labeling that paragraph I does, but if USP 797 does in fact require it, we already have a paragraph in the rule that says you must comply with USP chapter 797 requirements, and if it doesn't, then the question is, should it nonetheless be in the rule? We did have discussions among the Pharmacy Commenting Working Group about this, and I think there were very robust discussions. I'm sure Mr. Mixon has some commentary to make. Bill, I think I'm being fair to say you have very strong feelings about the paragraph in its presence. I think I can fairly represent that the other members thought that we could eliminate that paragraph and just focus on discussion of USP 797 and whether it requires this now or whether it should be amended to require it, and that could be handled at the USP level. So where we are, subject to as much discussion as you guys would like to have on this, is we could either continue to consider the rule.
Went into that preparation. How that's accomplished, I could care less whether it's a lot number, prescription number, whatever. But from the testimony, the public comments that we heard last month, it's clear that the managers that represents the hospitals that were here last month have no intention of accomplishing that. in my opinion, because there's no other way, or I didn't hear any argument that said, this is how we do it. So, because I believe that the components of these sterile preparations need to be able to be tracked backwards in the case of a problem or recall or some other event, I'm in favor of leaving Section I in the existing rule. Now, the problem comes from the fact that USP 797 and USP 795 were severed at the USP level. And what that means is that 797 does not need to, 797 can stand on its own without Chapter 795. Now, I know that's kind of technical, but
No, I get, your point you're making is that not everything in 795 is necessarily incorporated
into 797. So 797 today doesn't specifically say that a lot number and expiration date has to be on, or, well, the lot number has to be on the label. The beyond use date clearly has to be on there according to 797. So whether we leave Section I in there or take it out now, I think is kind of moot, because eventually 797 will be corrected, in my opinion, to require a lot number on the label. So the argument last month was, well, 797 doesn't say we have to put a lot number on there, so we're not going to do it. But the background on that, in my opinion, like I said in just a minute ago, is that without a lot number or some other unique identifying number, there's no way to trace back the components. And so I believe that's important, and I've said the same thing 3 times now. I think there needs to be some mechanism, and Section H specifically says you have to be able to do that.
Yeah, thank you. Just to reorient some of the board members, and I should have said this too, and Bill is exactly right. Paragraph H of the proposed rule does specifically require that any pharmacy that dispenses compounded drug products has to have a system that allows that pharmacy immediately to identify every compounded drug, preparation, prepared, labeled, or dispensed in the past 3 years. And my recollection is that it's more than I'm certain, nobody who testified spoke in opposition to that requirement. Just for you guys, what paragraph H was intended to do is that was really what the compounding log was, which has been in the rules since time immemorial. And so this was real, H really takes that same compounding log requirement, it updates it somewhat. In that it specifically says that that system can be created and maintained electronically, consistent with our Rule 2508. The bill is right, and it's not a new requirement that if we went in and said we're concerned that
work labels, whether, no matter what kind of pharmacy we're practicing, these records are really the patient's records. So if a coroner calls back and says, you know, this is what we found in this person on autopsy, did the pharmacy have anything to do with it? Well, I brought a little show and tell from where I work, and this is a batch label that, like we make 30 of these vancomycins, just for example, and it's got the date, the lot number that correlates to we can scan that, and we can find this lot number and all the components, exactly lot numbers for every single thing, and all we do is scan it. And I know I work at a place that has a lot of resources and some don't, but before that we used to just write it down, you know, pen and paper. But at any rate, we could track this back by that lot number, and that's the only way you can do it, as far as I know. And when there are official recalls from the FDA, which in 13 there were almost 60 recalls, and I think 37 or so so far this year. But whenever there's an FDA recall on a manufacturer, from a manufacturer product, the two pieces of information they give you that you can pull those drugs is, number one, the NDC number, which is a unique number for that product, and the second thing is the lot number. So, I mean, that's just basic to me. We just need the basic, at least bottom line, those those two parameters should be attainable.
So you're saying you're in favor of keeping I
I
in
would
place?
keep I, I would definitely keep I, and another thing I brought was this is another label where I work in, basically, this top layer that we take off would then go on the front of this, like so with the patient's information. This label with patient information would not contain the lot number. It just tells what it is, patient's name, count number, room number, all that kind of thing. But then the second part of of the label would be the bottom part, and that's where you would record this lot number and information on the work label, batch label, compounding label, whatever you may want to call that.
Doesn't gain anything, doesn't lose anything. I just, from my own personal perspective, I would vote this morning to leave out I in its totality and move forward with the rule with that out of it.
Okay.
We're not creating or redefining anything, we're just adding more verbiage to what's already there. You know, everybody has to abide by USP 797. We don't need to redefine it or specialize it or classify it. It's just what it is.
Okay.
That's my personal opinion.
Mr. Marks, any comment on your side?
No comment. I don't know enough about it to comment.
Can I ask another question?
Absolutely.
Mr. Campbell, is this the first, is this the only place in our rules that implements the requirement to comply with USP standards?
Yes, recall that the state of the world today is that current rule has a compounding log.
No, the new rule.
No,
Just
the new rule, paragraph H, would be what the compounding log rule was.
It
or
just says a
is.
record-keeping system.
Right. Mhm.
So on the inspection side, that record-keeping system is going to be, the expectation is for every ingredient in every compounded preparation, sterile or
And that's
non-sterile.
what the compounding log has always required. Look, from an inspection, let me say that from the way we inspect, just so the board members are oriented as to this, is I think you all know we've developed over the past couple of years some good inspection tools, and Bill's been involved with that. And but there's sort of two versions of what we do. There's the triage inspection, and I don't mean to say that to suggest that when we inspect a compounder, it's sort of a light inspection. It's not. Our triage is a fairly in-depth inspection. If in the course of doing that, we find, oh my God, even on the triage level, there are some real red flags here, then that triggers us going back in and doing what we call internally a deep dive. I imagine people who are subject to that would have other names for it that probably shouldn't be reproduced in the public record. But we come in and do an in-depth. With respect to interpretation of USP standards and what they require, it seems to me, and Bill, I'm out on the thin edge of the limb here, I freely acknowledge, that the Heartland stuff, there's really not a whole lot of debate. Everybody understands what the Heartland said. We do get into sort of, I don't know if periphery is the right word, but there are aspects of 797 that aren't totally clear. It's not super often that we really get bogged down in that. Usually if we're doing an inspection and somebody's not meeting the Heartland, I mean the heavy lifting 797 stuff, it's usually not a close call. Like, we're not sort of balanced on the edge of whether we think somebody needs to be disciplined because they didn't
Document
in the state. And we get feedback and try to resolve that and provide some guidance going forward. And all of that throat clearing is just to say that I feel confident that those who are the bad actors, we find them with the non-controversial aspects of 797. And I'm not suggesting we don't look to enforce all of it, but it's that Heartland versus the edge. And I'm certain that going forward, that whatever rule we wind up with, I think everybody knows it's going to specifically say USP 797 compliant. And there are going to be interpretive issues that come up over and over and over and over, I'm sure. The only way I know to deal with that is to convene these great experts we got in the state and try to come up with guidance and deal with it. But I don't think that the fact that there are disagreements on some of the issues in any way threatens the in any broad sense, the public health and safety, because the heartland stuff that we're really going in and looking to, that's pretty consistent. But we know we're gonna have interpretive issues. USP is too complex, it's too lengthy for people of good faith not to have disagreements of that sort. And what's been education for me is that on some of these issues, very talented expert compounders have good faith disagreements about what some of this means, and that's sort of the iterative process and that we're dealing with. But maybe to answer directly, the record keeping system, I think, Bill, what was chiefly driving the characterization here as record keeping system as opposed to saying compounding log was that there was a feeling that, and I remember this with the group as we were spinning through this, that there was a feeling that why do I need to have this separate book? When people say
Because if the lot number just goes back to a log and the log only says, I made ANSEF for this patient, it this doesn't require that the individual components be recorded.
So are you saying then you can live with HSIN to satisfy the concerns you have?
I can live with it, but I can tell you at the USP level, well, I better not say that.
Well, my comment on, I would agree with Mr. Minton. We have a standard 797 in place. Why encompass section I right now? If it's gonna be defined, it's gonna be defined through 797 down the road through committees. I think as a board, we need to make a decision. I would rather not table this another month. We've had it long enough, and we need direction as of today to move forward, so we can get Clinton and his team to go ahead and move this through. So I would like for the board to consider let's go ahead. There's two issues. Keep section I or remove section I.
And can I point out one more thing just for clarity on the record, Mr. President, just so it's here, is I think I mentioned it last month, but do note, just so we can say we specifically noted paragraph L, which would be would be relettered if we went to it. That was something that staff added going into the hearing last week. It wasn't in the published version of the rule, but just to remind you, all that paragraph does is say, if you need to get USP standards, here's how you would go out in the world.
It's not, I don't think it's really asking anybody to jump over any hurdles.
Okay. Any other comments? I will call for a vote. All those in favor of moving the rule forward with the removal of section I, please signify. Aye. Lozelle? All those opposed?
No.
All right, Jay, we have a 3-2.
Yeah. We'll proceed forward and take it to the RC. One thing, that active working group that we can go back to, get advice, get clarification, and publish it. So, I know this for sure, that anything that USB changes or clarifies, I've got a direct pipeline through Bill and through Jay.
And I want to take time to thank Bill personally for the work he did on that working group and his guidance and expertise.
Thank you.
I would, I echo that. Bill has been pulled an enormous laboring oar on this throughout, and will continue to do so, fortunately or unfortunately for Bill.
Well, I'm going to advocate at the USB level that we make this crystal clear, what's required and what's not required.
And
Which I think would be the best platform to do it. because
whatever USB says, that's what we're going to be enforcing.
That governs the entire process.
Crystal
Clear. I agree with that. All right, Mr. Campbell?
Those of us around the field appreciate cooperation with North Carolina Pharmacist Recovery Network for pharmacy technicians and students who are in need of services. I have the memo that accompanied your agenda, just re-summarizes everything we talked about. The action item is that the provide Stan with a copy of this too. So, because when I asked him, are you available, his correct question was, for what? So I provided him with the detail, but I'll get in touch with Stan and we'll get.
How do you want to go to proceed to start the first meeting to get this going?
Let me propose this. I'll get in touch with Valanda, so I'll know her, I'm sure she's one of the two, and then
Right.
whoever the other is, and I'll get in touch with Bob. And my thought, my request would be if we could wait till November to do something so I can catch my breath on a couple of things.
Okay.
But, I think once we get the group of 5, I'll just coordinate and figure out when we can convene here or at PRN.
It'd be nice if we had, at least have our first meeting by January,
Oh,
easily. December might be a tricky month, but we can,
I was
we
thinking
can,
November, but.
oh, well, if you make it November, that'd be fine.
Yeah, okay, I don't see why we can't get that done. I'll put that down as my deadline in November.
Do you have a person in mind as of right now, or are you still?
Abby Williamson.
That's what I
that-
figured.
That's what I was hoping you, okay.
Would be
I would
Abby.
agree
So
with that.
it's Stan, Joey, Linda, Abby, and, Bob Saunders. I will, in fact, today, I'll go
Okay.
ahead and
Okay.
see if we can get something.
Very good.
scheduled.
Next item, Mr. Campbell?
We don't have to have a decision on this today, but an issue has come up, and Debbie Stump and I have been talking about it, and it's our policy concerning technicians who practice at free and charitable pharmacies. I've reproduced in the little memo to you the statement that predates my tenure at the board concerning technicians, and it's our guidance on the website says volunteer pharmacy technicians providing services at a facility which has a pharmacy permit designated as a free clinic shall complete the training program described in the technician statute, but need not register with the board. I think it's clear what was behind that, right? Is free clinics typically don't have a lot of money, and having folks who didn't have to register, I assume that was the thinking on this.
What's it cost to register? Take-
$30.
$30.
$30.
Yeah, it's not a big cost. As with all things where you try to provide a good opportunity to folks, somebody inevitably is gonna take advantage of it. And lo and behold, that is what happened. We recently investigated a case, and I can't talk about this because there was a surrender, and I'm not sure I'm gonna tell you who it was. A pharmacy technician who had surrendered her registration due to diversion like a year or two ago began, what else we can do to her, because she doesn't have a registration. I guess what staff is concerned about is that this is not the first time it's probably happened, and it's probably not gonna be the last time it ever happens. And we're concerned we've opened up this window where folks, now, let me back up and say that it is fairly unusual that free here.
Is there any consideration, or would it be some kind of terrible deal if we waived the fee?
Waive the fee, that's the question on the table is, do we get into, we might could do it, I would want to explore a little further if we accidentally got sideways some way.
I'm not advocating that.
No, I understand, but it's the right question to ask, Jane, and,
My personal perspective is they need to be registered like everybody else.
like everybody else is registered.
And I would agree with that too, because I can tell you from personal experience, because I volunteer 1 or 2 days a month at a clinic at home. We had a technician do that, was not registered, but it was a reverse. Was stealing from the clinic.
Right,
She was, of course, fired,
right.
but she could go out and the board wouldn't know either.
Yeah, right, I mean, you're right.
So it
That's
go- it
that's
goes-
the converse problem, is somebody who's never been registered steals at a free clinic,
Yep.
then they go and get employed by Relo,
That's right. That's
file to be
exactly right.
registered, and we would have no reason to,
Right. I'm in favor of, my personal opinion is to have them registered.
It's purely from a patient care perspective.
Absolutely.
look, I am certainly not opposed to, one, I have nothing but admiration for the free clinic systems we have in this state. They do great work to highly underserved. I don't want to make it difficult for the free clinics.
Well, why don't we do this?
This is a patient safety.
Why don't we
I
do
think
this?
Probably the Joey McLaughlin Foundation will probably just provide funds for those.
He starts already. Why don't we do this?
I'd like to be general counsel for the Joey McLaughlin Foundation.
Yeah, I hear you.
honestly.
Why don't we, if it's with approval of board, let Jay move forward with the idea of having them register on the precept that we will research Mr. Minton's motion or suggestion, can that be waived and what ramifications will it have down the road? Just from a research standpoint right now.
Yeah,
I think it devalues the process, but I just threw the question out, but I'm
Oh.
not in favor of it at all. I
Oh,
think it-
okay.
You know, but anyway, I certainly,
what if we did this? What if it's the will of the board, send out something to all the pharmacist managers around the state, which would reach everybody that's involved at a free or charitable clinic, and explain the background. Just like this is what's been allowed, but this is the problem it's created. And say we are of a mind to require registration just like any other registration. I guess suppose we could give some sort of period of time. Well, we are coming up on renewal, so this, I mean, we could give some period of time to allow folks to do that, 3 months or 6 months. I mean, if folks say, well, I mean, we're gonna have to give them some period of time, where they can't all do it tomorrow, but they're already required to be trained. So if there was an objection, well, I've got to train them, well, they should have already been doing that
exactly.
under the.
Well, you're looking, you might as well say it's November 1st right now, and re-registration starts December 1st.
Well, actually, it starts November. but-
Oh, November,
That's
so
the-
really, so.
Can we say that by the end of the renewal period, which under grace runs until February 28th?
Right. I think that'd be an alternative you could use.
Okay. I can certainly communicate that out.
We do every day that we require that.
That's the
There's no
staff
question
approach
about
on
that.
this, is that we've lost a safety check, and I don't think lost it because nobody was trying to not be safe, it just,
Yep.
good intention.
Are y'all, the board comfortable to go to proceed with Jay's recommendation to get some feedback from the,
Yeah.
Do you need a motion?
do you
I
want
think
to?
if it's the consensus of the board, we don't need a formal motion that we're flagged. And what I understand is to communicate out what has happened, what the change is, and that we are going to look for technicians to be registered at any pharmacy, just like they would by the end of the 2014-15 renewal period, which would be February 28th. If we get some huge blowback on that, I've got no problem
Revisit.
coming back next month
Yep.
and saying, didn't see this coming.
Right.
Or there was an angle we had a blind spot on. That's fine.
So, doing that doesn't eliminate the possibility of getting everybody registered by the end of this year?
Mm-mm.
Okay.
No,
Any other comments from the board? Jay, go ahead and proceed.
I will do it.
Next item, please.
Next item, I prepared for each of you, and another action item from the retreat was, we had great discussion about pharmacists' access to and use of the North Carolina Controlled Substance Reporting System. I prepared a draft statement regarding that I've submitted to each of you. I guess probably we had it about a week, and sort of the gist of this is it's not, obviously it's not a mandatory thing. If we're going to order pharmacists to register or order them to use, that would be a rulemaking thing. This is a broader discussion of the value of the CSRS, ease, and what sort of expectations are. In many respects, this statement tracks a newsletter item from a year and a half ago, so there's not a lot of whole news, but it's there for your consideration. I have no pride of authorship on this. If it's crap, fine to change whatever needs to be changed. Or if you guys wanted to think about it further and we come back in November. I think Mr. Minton's point during the retreat was that it's incumbent upon us to make some sort of public statement to show that we're attuned to this issue in hopes of avoiding some of the more rash legislative proposals.
I think it gives us some degree of control, you know,
Yeah.
we can control what we do, or we can just have someone who don't know what we do tell us what to do.
Right, and board members, as it always is.
Comment from the board, please.
As I said, I do believe that if we don't act proactively, we might have something legislated we cannot do without terrible ramifications, you know. I was at a meeting the other day, and one of the pharmacists there indicated that his company policy was every time they had a new patient, they would run one of those things on a new patient or something like that. And I think we need to heighten the awareness and get people to realize, hey, you need to do these type of things. It's out there, tools out there, and if we don't do it, we're gonna, somebody's gonna say, well, we got to make everybody do it every time, which would be very, very tough.
And sort of the way I structured this, Mr. Minton, is sort of, the first paragraph is stating the obvious, we have a CSRS and what it's supposed to do. Paragraph 2 is, here's how you access or activate your access. Number 3 is, a general statement about we have a responsibility, just like every other healthcare provider, about appropriate prescribing and dispensing and use. The next paragraph is, like any healthcare, you're expected to use tools that are available to you and exercise your professional judgment. And the next paragraph is that we expect pharmacists who dispense controlled substances or provide pharmacy services to patients who are treated with them to activate their CSRS and use information available to them in an appropriate professional manner. And we likewise expect pharmacies and other places of practice to provide the tools and opportunity. It's not prescriptive, and which I did not understand was my direction, was to say
Right.
you must do it. I don't know how we do that anyway.
There's some statistics out there that show how little is actually used.
I don't know about the use piece of it, Mr. Minton. I know about the access and
Access. Who has-
initial access. And
access,
originally, like 2 years ago, for pharmacists and prescribers, it was less than 30%. For pharmacists, it's up more, and I want to come back to, we're going to have a better number at the end of February, but it's up significantly since May of 2013 when we opened the electronic portal. We had I think Debbie told me, gosh, I can't remember, but I can't remember exactly how many folks have used our electronic portal access, but I want to say it's like 2,200 or something. I mean, it was a big jump.
I just like to see a situation when, if it comes up in the legislature, we can go up there to those guys in leadership and say, we're working on this thing, and this is what we're doing. That's my position.
And
on
to that end, let me tell you about something, another direction I got from the board. Vincent is programming in. Fortunately, we were able to get in under the wire. But come November 1st, when renewal opens up, each pharmacist, when they renew, will be asked, have you activated your access to the CSRS, yes or no? The answer is yes, move on along. If it's no, there will be a redirect that allows the pharmacist to immediately use the electronic system to do that. It doesn't mandate, it's not a condition that says, well, if you don't do it, you don't rest your butt. There will at least be a point. So at the end of the renewal season, we should have, at the very least, number one, we will know how many total pharmacists have activated their CSRS registration. As it stands, we can tell you how many people have used our portal to apply, but to get the actual number, we can only get that from CSRS, or Drug Control Unit. We'll have that number. We will also be able to tie in, hopefully it will show, 1,000, 2,000, however many people activated. So I think we're gonna have a good set of data come the end of February to share, Mr. Minton, with policymakers if we're asked on that. That's in process. Vincent assures me that there will be no problem having that up and running. So that's in progress.
Mr. President, at this time, would it be appropriate if we have Mr. Ellen here from Retail Merchant Association? If he has any comments, also David from Mutual, they might have a comment on that. If you don't, it's fine too.
No, just quickly, I'm Andy Allen with North Carolina Retail Merchants Association, and I appreciate Mr. Campbell providing me a copy again of the newsletter of what you were considering. And I did another round of checking on, and I know it's been an issue in the past, especially concerning data breaches and viruses, and worry about getting those into a pharmacy computer system. The folks I talked to, they're providing access, everybody that I could find now for their pharmacists. None of that had been an issue previously in the past, although the data breach issue is still very real. The one thing I think just to be cognizant of is the question of, are you setting up a duty of care going forward? And not that that's a bad thing, but that is something that could be used potentially in litigation should there be an error from a controlled substance of, if the board sets up the statement, are you something that somebody can say they did not use the CSRS? And I'm not saying that's a bad thing one way or the other, I'm just raising that question. Back
Wouldn't you also say that that's already there?
I'm not saying it's not already there, but I'm saying it's a.
Is that right, Jay?
I'm sorry, excuse me.
Sorry.
It could become something that puts in there. And again, I'm not saying that's a bad thing, because we think it's good that people have access to it, that they utilize it. We're hoping to have a great increase in it. You referenced legislative, and I think it is something certainly under mind. Controlled substances always are, and the use of that system. And I think you're looking at right now the recent rules that the DEA published, the 52 pages of rules and comments concerning take backs. And I think there's going to be a push to try and require pharmacies to take back controlled substances. Which, if you read those rules and the parameters around it, it's a, you know, the DEA goes to very great lengths to say, we didn't mandate this, we didn't mandate this, we didn't mandate this, but for people that want to do it, here's all the things you have to do. I think there'll be some state legislature that really won't care about that part of it, but I think this is another piece that we can say that pharmacies are doing the things that they should be doing to hopefully ensure that controlled substances are not improperly used or do not get into the hands of people that should not be taken. But appreciate it, thank you very much, Mr. Campbell.
Thank you.
Thank you, Dave Moody with Mutual. With the work that we do with DEA for all of our stores, and looking at the other states, at national meetings I go to, states are already looking at requiring some of this. They're putting committees together. I think if we step forward, it's better to put something in place yourself than, as Gene said earlier, mandated. It would be hard to do. And I can tell you now, with working with DEA, I know that they're looking to see if people are looking it up. It is there. I think our pharmacists throughout the state can help the public tremendously if they start using this. I mean, I only recommend doing it. Thank you.
Any other comment from the board?
How's this gonna be communicated?
I think at least two ways. Of course, we'll put it on the website. Kristen will tweet it out.
Okay.
We could do an email blast to everybody, letting folks know that just to take a look at this statement, and of course it'll be in the next newsletter. And then I'll talk about it on my sort of CE tours around the state,
On your circuit?
including next week at the NCAP meeting. So I do. I mean, again, with respect to the sort of ERSAT's negligence per se, that's something I'm certainly familiar with. I would just, in response to that, say that the statement here is not prescriptive. It's hortatory. So.
And let me say one thing, I'm sure David would probably do the same thing. We are happy as soon as we get the statement to push it out to our members to go ahead, to encourage them from a corporate level to go ahead again and make sure that they get people registered for the CSRS. And I think they did, the legislature did do a good thing last year of allowing the information to go cross-border between states, which hopefully will also be very helpful in trying to prevent controlled substance abuse.
To address what Andy was talking about, y'all know about, well, PNP Interconnect is the only version of interstate sharing that actually works. There's one other that certain people who have a direct monetary stake in are in favor of. Of course, it doesn't actually work. But there was a bill that did not. It got hung up at the end.
I think that little piece got put in technical, correct?
Did it get put in technical, or maybe it did, but I understand, I can report back that some folks in NMBP told me last week that this very, I'm sure, dusty document that's been sitting on somebody's desk for 3 years at DHHS has finally apparently cleaned it off and taken a look at actually signing this thing so that North Carolina could participate in PNP Interconnect. Why it hasn't happened to date is a bureaucratic mystery of the highest order. I can never find anybody over there who will actually say they are the one that have to review it. So that's coming, yeah. But I can go, if you're comfortable with the statement as written, I am more than happy to go forward with it, or if you'd like to think about it further, that's okay too, whatever you want.
I would say from the sound of the board, we have consensus, go ahead and push that out then.
I can start that tomorrow.
Okay.
All
Next
right.
item, please.
I will do it. Next item, the NABP is having, on December 2nd and 3rd, is having its interactive board member forum. Some of you have been to this, I think, but this is a much less formal NABP meeting. Last week, we had the interactive executive officers meeting. There is each year an interactive legal officers meeting. This is more sort of let's all sit in the room and talk about practical stuff and work through those. Each board has been asked to designate an attendee, and I need to know who among you, and Mr. President, this would be your discretion here. So it's December 2nd and 3rd, Tuesday and Wednesday at NABP's headquarters in Northbrook, lovely Northbrook, Illinois. So whoever's available and interested, I've got to let
available
Penny
and
know.
interested.
What's that?
Bill mentioned here, I've got commitments those 2 days.
December's a tough month. It always surprises me they scheduled this thing in December. But
And you will be going?
I'll be there, yeah, because I'll be there for this, and there's an executive committee on the back end of this thing, so I'll be here.
All right. Anyone else? Sound like Mr. G? Sound like Mr.
I
Mc-
went before, I've gone one time,
Okay.
somebody else's turn.
There you go, Jay.
I will, Bill, I'll copy you. I gotta let Penny know today. I'll CC you on this, and we'll get y'all squared away on that. Report on the Leaders Forum. I don't really have, first of all, the only thing I know to report is that the informal feedback I received was that folks seem to really like the format and the discussion this year, and it was very sort of discussion focused, and there were very positive aspects coming from that. I am working with Dan Barbara to get a post PLF roundup so we can talk about that. I will be prepared to report back to you at the November meeting, sort of the thoughts on that, and then we'll need to make a series of decisions about the PLF going into next year or so. But I wanted to round up with Dan. I apologize that I was unable to do that before this meeting, but I've been on the road about 2/3 of the days.
What is your comfortable time frame into 2000, as your drop down date that you've got to make a decision for?
What's usual in terms of making arrangements with the venue in Illinois?
Well, they usually like to at least get the venue by January.
Yeah, that shouldn't.
Then we can make that, get the file back and talk about it by January meeting, to make a
Yeah, I
decision?
don't see why. What I would, I expect I'm gonna meet with Dan during the NCAP meeting next week. Let me collect all that. I could even send out an email to all of you guys and sort of summarize that up and then say, okay, here are the things we need to decide. And I don't see any reason in the world why we don't get that decided by or at the November meeting.
Okay,
Yeah.
And then we'll make all the
let's
arrangements.
try to do that then.
Okay. Will do. And I do not have any update on the Program Evaluation Division study of the occupational licensing boards. As I reported before, Joey and I and staff went over and had a lengthy meeting with them, but it's been radio silence from PED. I don't know, Andy may know something about that, but
Now, as I said, I don't think you're one of the licensing boards that really looking at very hard.
I hope that will be true. I'm very concerned about undertow effects that are associated with any sort of grand unifying theory of licensing boards, so
I did see your picture on a couple of walls over there last week.
I'm sure, and it probably had a target and horns drawn on it, I imagine.
So I said, who's that guy?
Yeah, that's right. Damn, he's ugly.
Mhm.
So I'll let you know when I hear more about that. Somewhat, it's not specific on the just to give you a quote. I did go to the Federal Trade Commission Dental Board Supreme Court argument last week. It was part of my triangular trip. Ellen went as well. I'm not, for the record, going to state any sort of prediction. I thought the argument went well. I think the court, the only thing I will say is I think the individual members of the court are struggling with this issue about antitrust immunity for licensing boards. And it may well wind up being a fairly splintered court, however it comes out. But So the one thing some folks have asked, when do you think we'll get a decision? I would have said February at the earliest from an October argument if the court is as splintered as they appear to be, and sometimes it's just appearance. They're not as splintered as you think they are. It could be March or April before we get it out if there are 2 or 3 opinions. But I thought Jones Day, the old alma mater, did a good job presenting the best case that could be presented on that.
Can you elaborate exactly what's at stake? What
Yeah,
we're
this
deliberating?
is, recall that the Federal Trade Commission, which is the government agency charged with enforcing the antitrust laws of the United States, brought an action against the dental board stemming out of the dental board's attempts to regulate teeth whitening. And the Federal Trade Commission alleged that the dental board itself, made up of practitioners in the field, as is true for virtually every licensing board in the United States, made an agreement to restrict trade, which of course any rule we make restricts trade in some ways. And filed an action against the dental board. There were a number of issues in the case, but sort of the one that matters at this point is there's a doctrine under federal antitrust law that developed in the Supreme Court called Parker immunity, which at its broadest sense says the states, that the antitrust laws of the United States were not intended to apply to states acting as sovereign bodies. So if the state does something that's anti-competitive, which describes most regulation, you're not subject to getting hauled into federal court and being found liable for treble damages and injunctions and all those good things. The question is, to what other state-affiliated bodies does that immunity apply, and under what circumstance? And the Federal Trade Commission, to no great surprise, found that the dental board was on this scale between, do they look more like a state body or more like a group of private actors, look more like a group of private actors, and there wasn't sufficient oversight from the state in its actions, and therefore they were subject to antitrust liability. And that's what's before the Supreme Court is, does an occupational licensing board enjoy the same sovereign immunity from antitrust law that the legislature enjoys, that the court system enjoys, that municipalities enjoy, et cetera. And it's a big deal case.
So if the court throws out the Parker
For the licensing board,
thing, how does that affect us?
it means we have to continue to be, we're charged with protecting the public health and safety. And our calculation on how to do that should never, ever involve, well, we want to protect so-and-so's business model, or we don't think there are enough jobs available, so let's not allow somebody else to do something because we're trying to preserve jobs, and that sort of thing. Economic situations of that sort can't, under state law, can't be a reason for the things we do. But if we did those things, then we run the risk that federal agencies or private parties could bring antitrust actions against the board. And the transaction costs of those sorts of litigation are extremely high. It's a matter of staying focused on what we do and the way we do it. And if we turn sharp corners, as we're required to do under state law, this shouldn't be a great risk. There were factual issues in the dental board case that made them particularly susceptible to a suit of this sort.
Said like a diplomat.
I could have a more blunt conversation in other forums.
Well,
Jay's
but where
right.
are-
The state ethics rules, I'll use Parker as an example since he's not a pharmacist. If he had a pharmacy, clearly say, he shouldn't run out a business, somebody who's, across the street from him, or, they do mail order and they compete, or, he shouldn't say, I don't want this out-of-state pharmacy because we got enough here, or whatever. and just as a matter of ethics rules and fairness, you shouldn't do that. But essentially, if the dental board loses, then somebody would say, well, I know you're not supposed to do that, but that's what you were doing to me, and I should get money from you for doing it.
For doing that.
Okay. We're already pretty careful not to do that.
Yes, I mean, yes, we
Most
are
of us.
and always have been, and that's why sometimes Clint and I irritate the hell out of you on some of these things, but we're just trying to make sure we're staying in our lanes on that. But no, an occupational license board that is conducting its responsibilities to protect the public health and safety, and that's the actual motivation, and we're following the appropriate procedures and the like. Very little to be worried about. We might look at one of the things we might need to do is if the immunity doesn't exist for boards like, or only exists for us under certain circumstances, we might need to look at some of our insurance coverages to make sure we've got what we need. But we'll do all of those things. Outside of that,
Yeah, I've not seen anything over the years that I'm convinced that any board member or the board would lose a case brought in antitrust laws. Problem, and the purpose of immunity is to keep you from being
From
harassed and having to defend yourself. And so that's really at stake, is the litigation cost of somebody who's dissatisfied having another outlet to express their dissatisfaction rather than through the judicial review process, which is how it's supposed to.
yeah, just remember that under state law, anybody that doesn't like something you've done, they can certainly run right over to Wake County Superior Court and file a challenge to what we've done. And fortunately, that rarely happens. And
It has, and
but it
we
has
deal with it.
happened, and we deal with it. But if folks could also run to federal court, file an antitrust action, it's a lot more expensive proposition. We'd be briefing the hell out of motions to dismiss those, that's for sure. So that's the background on that. So obviously we'll keep you posted on that. But it's a case that's being watched very, very closely from a lot of quarters. And there were good arguments on all sides of the question last week.
George Will even wrote a column.
Yeah, that's. I bet when Bobby White became the executive director of the dental board, he probably thought he could have gone 100 years, and his stewardship of the dental board would not have been the subject of a George Will column. But that's. I'd prefer to be way under those types of radar, but we'll see. Investigation statistics. Look at Josh in his tie.
Plethora of them.
Yeah.
Well, just something far less interesting than antitrust.
Right, there got to be at least two topics on the face of the earth less interesting than antitrust law.
Investigations for the year so far, we're hitting at, as you see, 186. The ones that are still leading the pack are the ones that are procedural and legal, followed by a close second of the errors, diversions, and inspection follow-ups, and then the incident reports are bringing up the very end. For surrenders, we have had a few more since the last board meeting. We are up to 32. Techs are leading the way, and pharmacists, we've had a couple more of those, and then pharmacies have stayed the same at 4. Things are rolling right along. Our new folks are are at the very tail end of training. Everybody's doing extremely well. We felt like we hit some more home runs with the new hirees, Lisa Mendez, Liz Collier, and Maria Fabiano. So, like I said, they're at the tail end of their training, and they seem to be catching on very well. A lot of kudos go to Crystal Bashirs, who's doing the training, Loretta Wisner out in Asheville, Holly Price Hunt, Hickory area, Jason Smith in Charlotte, and Ken Wilkins. They're all just doing a great job training these folks. Couldn't ask for anybody or any better folks to do this.
One thing to note, these statistics and various others for the past fiscal year, we're compiling right now. Our annual Chapter 93B annual report is due by Halloween Day. It's really pretty much drafted out. Of course, I will send you all a copy when that gets filed, but just recall there are certain data, and God knows we've gotten good at compiling that sort of thing. And so we're putting that together now, and I'll write, as I always do, an introduction, but the introduction is just sort of a recap of things that have happened over the past year. So I'll get you all a copy, but that's on track to get filed next week.
Very good. Thank you.
Thanks.
All righty, yes, sir.
And Rhonda is going to provide the financial update.
Gail's here, but she's not feeling well, so.
Okay.
What you have in front of you for the financials are the unaudited figures for September 30th. We have our audit on November 3rd. So you'll see the balance sheet and the statement of year-to-date revenues and expenditures with comparison to annual budget. Our cash balance at September 30th is $6,322,408. The excess revenues over expenditures for this fiscal year is $648,124. And that's on line 29 if you have any questions about where that is. Total revenues through September are $3,946,235. So right now, that is, the revenues are $103,431 over budget. Does anybody have any questions?
There's nothing in here that's a surprise or materially different from last month's report. And you can plan on having the audit report presented to you for your consideration at the January meeting.
Right.
We usually get the draft in December, but we don't meet in December. And just so you know too, we did at long last finally get some concrete guidance about when we file these financial reports from the Office of State Budget Management. So unlike past years where I keep filing duplicate copies at 2 or 3 different times of the year, I do know finally exactly when we're supposed to file those. And with your approval of the audit report at the January meeting, we fall well within the window of making that report. So we don't show up on some naughty list that somebody's compiling.
Thank you, Rhonda.
All right.
There are any reports to the board? Rhonda, Valanda, I think you certainly made a report to the board. I know the NCAP folks are not here. I don't think there are any. That would just leave the consent agenda.
So board members, if you had a chance to review that, I'd like to have a motion on the consent agenda.
I move we approve it as presented.
Second?
All in favor?
Aye.
Aye. Consent agenda is approved.
I have one, I'm sorry, do have one clarification, advice of counsel. Can we go back and clarify for the rulemaking, can we clarify that, for the record, that your motion to proceed forward was with the full slate of the amendments? Because there are repeals of some other rules and some formatting changes. Is it, for the record, that was for the entire, with the extraction of the paragraph? Has that got it?
Yes.
That's what we need.
Right.
I was not alert to this earlier, and I didn't listen to the phrasing of the motion, so I just wanted to make sure that we had that on the record.
Mr. Chairman, may I ask a question under other business, which is not on the agenda?
Sure.
Any, Mr. Campbell, any
Yes, sir.
information from NABP on the memorandum of understanding that was required by DQSA?
No, that was asked at the Interactive Officers Forum. There's still no date on which we expect to see that thing, but I think you should raise that again when we go up in 6 weeks about that. But radio silence as far as I know. And am I correct, we don't have closed session matters, so.
Any other business to be brought before the board today? Or any comments from the persons in the audience?
Kai back here, Kai Jones who's introduced everybody. Kai is rotating with Bill. Kai was my law class award winner, 2 years ago, Kai? And he is going to be doing a rotation here for 5 weeks, starting right after the new year. So, Bill, you're lucky to have Kai, and I'm going to be particularly lucky to have him for 5 weeks come January. So you'll get to know him
Well, I hope you can say you'll be as happy to have Jay then.
No, he knows what he's walking into here on this, but I do look forward to having Kai.
Any other comments from the audience? Yes, ma'am.
Oh, yeah, I'm sorry,
It's a comment
about Ebola, so
Okay.
that's
And I'm trying to do this without hysterics and these are two observations, and I don't see anybody else addressing it, and I see it on the.
would you like, why don't you come up to the mic so that.
Come on up.
It's a public meeting.
We won't
No,
bother.
you
YouTube.
really do need to come up to the mic so you can.
I don't talk in front of groups.
Most people don't, but that's all right, we don't fight.
My observation and concerns is about Ebola.
Could you introduce yourself, please?
I was gonna try to do it without hysterics, so. My name is Linda Lepre, and I am a pharmacist, and I'm not gonna name the retail that I'm with in Kinston and Goldsboro. So it's out in the rural areas. And, my observations was, one of the first things that I saw was when it was misdiagnosed, the first thing he had was a paper in his hand to take to a pharmacy. So, is it spreading? Will it be able to spread that way? But if you can keep that in your mind. And the second observation is that, I think it was a Pharmacy Journal about a year and a half ago, was talking about Nigerian pharmacists, and that they were passing away because the public would come into them in Nigeria and be ill, not be able to have a place to go, and not be able to have their illnesses, and asking us what to do. And so I'm just, it seems like we're on the front end. I see hospital pharmacists being addressed, but we have waiting rooms, we have people come in, I go out with them, but I just wanted to, if we could just keep it in our mind, that there is retail that is a concern of spreading, not just out, but other things too. So, that's my only.
And I did want to point out, and if you look at the top of our homepage, the North Carolina Department of Health and Human Services has put up an Ebola information website that is directed both to the public and to all healthcare providers. It includes specific information from DHHS and from CDC about infection control generally and other things. We have the link to that on the front page. We tweeted it out. I have not done a mass email. We tweeted that out as well, and is Amanda Fuller Moore, who all of you know, who's the pharmacist for North Carolina Public Health and Emergency Response. She is involved with the creation and maintenance of this. So we do have a pharmacist who has practiced in many different pharmacy settings, who is aware of the issue and is contributing. So we'll certainly, from a staff standpoint, continue to be a passageway for information for pharmacists now.
Thank you, ma'am, for coming.
And it's a great, and Linda, if you would be sure, folks, I mean, when you see that thing, make sure your colleagues and the like are seeing this thing.
Okay, well, I know I've got
Clicking
a
on it.
CDC and the addressed hospital, but not.
Right,
retail.
right.
Any further business coming for the board today? Hearing none, I have a motion to adjourn. So move.
Second.
All in favor?
Aye.
Motion adjourned. Thank you all for coming today. I would think.
You wanna wait 2 hours, you can have lunch.
When Cindy gets that CD done,
We had a really good
You
time.
want-
We got to drive.
I could drop it by your house, or you can come and pick it up, or we can mail it, whatever's easiest for you.
Mail it to your house.
That's good.
That'd be
If you
all
don't
right.
mind, that'd be easy.
Driving. Getting in the car.
Just mail, yeah.
And you get, we had a GPS.
Carol, are you saying you're not gonna be sitting every day, sort of?
It was
Well, not
being
really.
in
I wouldn't go that far.
North Carolina.
You know, it's, yeah, that, y'all went over retreating you and Jim Caldwell to do.
Oh,
All the attention,
right.
I missed
How
that.
much seed?
call Ebola, bird flu,
It was just,
or
We're in a
obesity,
villa.
labor.
okay.
I know, right, and cardiovascular disease, all the other things that kill millions of people every.
It was
So
just
you're a diet plan?
the facility was
Yeah.
completely
Is it a
powered.
programmatic thing, or?
It's, no,
No,
It'd been there for probably.
you're not gonna go to Earnhardt Healthy Weight Loss like Bruce Kell?
my daughter just emailed me or texted me, eating amazing sausage, biscuit, and chocolate chip pancakes. Apparently the dining hall.
One male out of 14.
Dining hall is what?
The dining hall in Alabama.
Three separate centers.
Tuesday's always steak
First cousin.
from lunch.
It was really
Uh,
good. And I think
At work, we started doing this thing for the holidays, run to January,
and I think
and we're using
two
mine.
sets of them became very close. We
So it's just logging in calories and tracking exercise.
And then
So-
mothers.
You wanna run a 5K?
Meeting.
No. I'll tell you what though, Fred is the main beneficiary slash victim of mine.
She was a retired
Health
civil
plan.
engineer with California. Very, very good. And Paul
Just
was
lengthening walk in ways that he's not
Yeah.
necessarily.
Thomas was not happy with me last night. I went out, I'm trying to do some good photography.
She was kind of like us. She was a money market
And so,
man. Like that for two.
When I got home last night, I got Thomas. I was gonna go to the Maple Farm. Because if you've been out to Maple,
Yeah, but
the ice cream place, well, you're sitting up at ice cream places, this huge feast down at Sick Farm, back at White House, all that. So I went this way. And they just plowed up, so it's not your picture. So I kept driving around, eventually found this old barn.